Welcome to the UNCG MSAT Continuing Education Module on Evidence-Based Practice. This is Part 10, Evidence-Based Practice at the Shoulder. This is the final part that you will need along with the quiz that you must complete to obtain your CEU. Let's begin. If there is one body part, with the exception of maybe the back, that confuses and frustrates the students at UNCG more, it has to be the shoulder. The multiple special tests, the overlap of special tests, and the ever-changing name of the special test is a constant source of frustration for our students. What we are starting to teach our students now is to look at the evidence and pick 2 to 5 special tests which work really well, have good evidence, and that they feel comfortable using when conducting their shoulder examination. Now, looking at the evidence in the top boxes here, you're going to see that they have compared 3 of our classic special tests for detecting a SLAP lesion. You notice that this study has calculated sensitivity, specificity, positive and negative predictive values, and diagnostic accuracy. All of these have been discussed in our previous videos. When you look at these comparison of tests, you notice that their sensitivity values are quite poor. You notice that their specificity values, though, are better, but still only the anterior slide shows something that we would consider good. What this means is that the anterior slide, when positive, is good for ruling the SLAP tear in. You notice that our positive and negative predictive values are also listed. If we come down here and we look at the individual history and physical exam findings for a type 2 to 4 SLAP tear, you can see that certain history questions such as trauma, sudden onset, popping and clicking, and again we have calculated sensitivity and specificity values. If you've watched the other videos, you'll notice that this is the first time that one of our studies has demonstrated or shown positive and likelihood ratios, positive and negative likelihood ratios. You'll remember from our previous videos that although this is a better statistical evidence test to run, it's quite confusing and most studies do not report them. If you remember, you want your positive likelihood ratios to be greater than 10 and your negative likelihood ratios as close to 0 as possible. A quick scan will show that none of these have very strong positive or negative likelihood ratios. In fact, if you look at active compression tests on physical examination, its negative likelihood ratio is greater than 1 and its positive likelihood is close to 0. This means that this particular test is not very good at all for looking at a type 2 to type 4 SLAP test. Using this information, one thing we try to teach our students is that the shoulder is very complex and that there is not one gold special test that you can use to rule in or out a condition. Unlike the knee or the ankle, a lot of these special tests have to be used in combination to determine a clinical decision. This is important for our students to realize in case they're looking for that one golden bullet that they can do one test and be done with it. The shoulder simply does not work that way. Now, a study that just came out last year in 2012 is a study that I just started using this year with our students, and it is a fantastic study. And I suggest if you have one study to read on shoulder examinations, it would be this one. It is a meta-analysis of the special tests for shoulder pathologies, and this is one of the tables from that study. You can see that they have looked at a tremendous amount of studies, in the hundreds of studies, and they have looked at all of our classic special tests we use for our most common pathologies, from impingement to SLAP to instability. They have calculated sensitivity, specificity, our positive and our negative likelihood ratios. So they've looked at the big 4 statistical analysis that we want to look at when addressing the evidence. You're going to notice that overall, a lot of these special tests are absolutely, positively horrific and maybe shouldn't even be used. Speeds test in particular, when using for a SLAP test, has very little sensitivity, very poor specificity, and its likelihood, positive likelihood ratio is atrocious. Its negative likelihood ratio is greater than 1. So we force our students to ask themselves, would you use a speeds test to determine a SLAP lesion, why or why not? In contrast, the apprehension test for anterior instability has very good specificity at 95%, and its positive likelihood ratio is 17. If you remember from the previous videos, anything over 10 is considered large and conclusive. So if you have a patient with a suspected anterior instability and you are not doing apprehension, it begs the question, why? Again, we are forcing our students, or at least trying to have our students, think critically and question why they are doing what they're doing with their examinations. Using all parts of evidence-based practice, you can come up with the best and most effective clinical decision for our students. Now, I hope all 10 of these videos have helped you understand evidence-based practice as a whole, the basics, the foundations, how it's being implemented in the current literature, and more importantly for your role as a preceptor in our program, what we're teaching our students and how we're asking them to apply this into the clinical setting. We are not asking them to use research as the only criteria for why to use a special test, and we want your input as not only your personal and professional experience, but also your experience working with patients to help determine the best clinical decision for the patients. We hope that this opens a dialogue between you and the student where you can agree and help to develop a philosophy of how you wish to evaluate and care for your patients. Please go to the link located below this video on the YouTube page to complete the quiz to get your final CEU verification. We thank you for taking time to do this. We thank you for being a preceptor with our program, and we wish you many, many healthy seasons ahead of you. Thank you very much.